My dear student, good morning. Today I like to highlight all of you one of the most important topics. It is very much important in our clinical practice all over the world. Remember this. This is called viral hepatitis. Viral hepatitis is a major health problem, both developing and underdeveloped countries all over the world. Remember this. This viral hepatitis is caused by the 5 hepatotrophic virus, and it is about 90%. And rest 10% is non-hepatotrophic virus. The hepatotrophic virus is hepatitis A, B, C, D, E. Then non-hepatotrophic virus is Steinberg virus, cytomegalovirus, herpes zoster virus, then rubella virus, then enterovirus, then adenovirus. These are all of the non-hepatotrophic virus. This is about 10%. Next, this is caused due to the this cause is due to the the autoimmune hepatitis. Autoimmune hepatitis means it is strongyl cholangitis, SLE, and GIA. Next one is metabolic cause. Metabolic cause means alpha-1 antitrypsin deficiency, then Wilson disease, then cystic fibrosis and galactosomia. Remember this. Next one is drugs and toxin. Remember this. Drugs and toxin. What are the drugs? Antitubercular drugs, methyl dopa, methotrexate, and mushroom poisoning. This is the most important cause of the drugs and toxin. Remember this. Now you should know a little bit pathogenicity of the viral hepatitis. What is the hepatitis? Injury to hepatotrophic virus involve both cytopathic and immune-mediated injury. Degeneration and nodular parenchymal cell. Remember this. Complete recovery occur. Complete recovery over always remember this. Complete recovery over hepatitis A virus. But hepatitis B, C, D. Hepatitis B, C, D always happen. Chronic hepatitis, chronic active hepatitis, and cirrhosis of the liver and hepatocellular carcinoma. Remember this. Now, how the patient is present to you? How the patient is present to you? The presentation is the 3 stages. You look your box. One is pre-ecteric phase. Pre-ecteric phase. Pre-ecteric phase. What happened there? There is nausea, vomiting. Nausea, vomiting, mild fever, surround sickness type symptom. Then fever. There is a flare in the right upper quadrant. This is the pre-ecteric phase, and there is supraorbital pain, body ache, myalgia. This is all of the pre-ecteric phase. Now the ecteric phase. The ecteric phase, what happened there? There is a jaundice appear and dark color. You remember the dark color, and there is also hepatosplenomegaly, lymphadenopathy, and there is also some body ache and other symptoms. Next one is post-ecteric. Post-ecteric phase, what will happen? During post-ecteric phase, what will happen? The hepatitis appears and jaundice disappear. Remember this. This is called post-ecteric phase. Now, what are the sign? What are the sign of the acute viral hepatitis? Sign is tender hepatomegaly, splenomegaly, lymphadenopathy, and there is a acrodermatitis. There is acrodermatitis. This is called Zanotti-Conti syndrome. This is the dermatitis, a case of maculopapular dermatitis of the extremities. This is called acrodermatitis. Another name is Zanotti-Conti syndrome. Remember this. Next, what are the investigation? What are the investigation go for the acute hepatitis? First of all, liver function test. First liver function test or complete blood count. First of all, there is a complete blood count. Then liver function test. What are the liver function test? Liver serum bilirubin, serum ALT, serum ALT, AST, prothrombin time, and serum alkaline phosphatase. These are the liver function tests. We go some renal function test. Renal function, serum creatinine and blood urea should be measurement. Next one is ultrasonography of the hepatobiliary system. Ultrasonography of the hepatobiliary system. Next, liver biopsy should be done to differentiate in between cirrhosis of the liver and chronic liver disease. Last one, we go for some viral marker. Remember this. Serology means viral marker. We assess some viral marker. Viral marker, what are the viral marker we see? You look, there is some antigen and antibody we detected. Some antigen and antibody, this is called viral marker. Remember this, look towards the my hepatitis A virus consists of two antibodies. One is anti-hepatitis A virus IgM type, IgM. This is the recent infection. Recent infection. This is called recent infection. And anti-hepatitis A virus IgG. This is a protective antibody. Protective antibody. This is protective antibody. Remember this. These are the hepatitis A. Next, go for hepatitis B. Next, we go for hepatitis B. Hepatitis B, what happened? 3 antigen, 3 antibody. Remember this. 3 antigen and 3 antibody. What is the antigen? Antigen, what is it? B, surface antigen. Hepatitis B, E antigen. Hepatitis B, core antigen. And for this 3 antigen, that the 3 antibodies, remember this. 3 antigen for 3 antibodies. Hepatitis B, surface antibody, NT. This is called anti-HBs. This is the protective antibody, protective. This is the protective antibody. Next one is anti-HBe. This is seroconversion. Seroconversion. That is, patient is improving after treatment. Seroconversion, patient is improving. This antibody indicate patient is improving after treatment, or viral replication is lower level. Remember this. This is seroconversion. Remember this. Next one is core antigen. What is the core antigen? Anti-HBC. It is two type, IgM and IgG. IgG. IgM means recent infection. Recent infection. IgG means it is chronic infection. Chronic infection. This is all about the viral marker. This is all about the viral marker. All about the viral marker. Remember this. This is all about your viral marker. Remember this one. You should remember this. What the antigen and antibody? You should remember this one. What the antigen and antibody? You should remember this one. Finally, we go for management. What is the management? What is the management of the viral hepatitis? Is very much important. Is all the patient is not required to admission in the hospital. It might be home treatment is enough for maximum of the patient is not required to admission in the hospital. Remember this, only symptomatic treatment. But so there is some warning sign. There is some warning sign. There are some warning sign to admitted in the hospital. What are the warning sign? This warning sign are persistent fever, persistent vomiting, persistent anorexia, bleeding tendency, alteration of sensorium, gastrointestinal bleeding, fluid retention, decrease liver size, and increase of the serum alkaline phosphatase or serum ALT/AST. In this time, we will admit the patient in the hospital. Now, what is the B? How is B? Hepatitis A. In treatment of hepatitis A, just symptomatic treatment, complete bed rest, fluid and nutrition, and the regular bowel clear by the lactulose, and H2 receptor blocker should be given. Cimetidine or ranitidine should be given for H2 receptor blocker. This is the treatment for the hepatitis A. But treatment for hepatitis B require the treatment. What are the treatment should be given for hepatitis B? 2B, interferon 2B, interferon alpha 2B, and lamivudine is the drug of choice of the hepatitis B. Remember this. It should be given 5 to 10 international unit per square meter of body surface area subcutaneously every alternate day for 6 months. Remember this one. This is the treatment of the lamivudine should be given 5 to 10 minutes per 5 to 10 milligram per kg of the per day divided dose for 6 months. Remember this. This is the treatment of hepatitis B. Remember this. So what are the treatment of hepatitis B? Is interferon gamma alpha 2B, interferon, and lamivudine is the drug of choice of the hepatitis B. Now what are the treatment of hepatitis C? Hepatitis C, you look. Hepatitis C treatment is, this is also alpha interferon and ribavirin should be given. Alpha interferon and ribavirin. Alpha interferon should be given 3 international unit per square meter of surface area. Every alternate subcutaneous, every alternate for 1 year. And ribavirin should be given at the same duration for 12 months. Remember this. This is all about the treatment. Now what are the prognosis? Majority of the children is improving within 2 to 3 months. Maximum medical should be 2 to 3 months, but 6 to 12% patient may develop remission and relapse of the condition. Now, one thing is very much important. You are putting out in your box. What is INR? International normalization ratio. INR. You look your box. INR. Not here. INR. What do you mean INR? What do you mean by INR? International normalization ratio. It is the look. Write to me. It is the ratio between the control and serum prothrombin time. This is called international normalization ratio. Now what are the indication of the INR? What are the indication of the INR doing? It is doing to see the adverse effect of the warfarin and monitor the liver function. This is the indication for the INR. If INR is more than 1.5 units, then we give the vitamin K injection to the patient, or when the INR is more than 1.5 international units, then thinking the patient is going to the liver, going to the liver failure. Remember the pulmonary liver failure. Remember this one. This is very much important. INR, about the INR. Remember this. This is all about. Thank you very much for patient hearing.